Okay. Everybody knows where that is, right? On the coast?
Unimog.
And that's the Unimog, that's the big truck, and that's the Tyrannosaurus. Okay, when sex doesn't work. Okay?
Oh.
You get it, Sharon?
I finally got it, yeah.
Excellent. All right, so the next thing is that people come in, and the most common is, Dr. Laury, I don't enjoy sex. I don't have the interest for sex. And that's the libido issue. So when I use the word libido, I mean the sexual interest, the sexual drive. By far, that's the most common question. There's about 5 different possibilities that I go through with our ladies. And you can nod your head if it sounds familiar, but generally speaking, in no special order, is fatigue. So it's 10 p.m., you know, husband, I'm just doing male, female, I can alternate, whatever. But let's say a husband wants to cuddle, it's like 10 p.m., and it's like, okay, sex or sleep? Sex or sleep? And invariably, women will tend to pick sleep because it's 10 p.m., they've been up all day, they work, they work at home, and now the husband wants something, it's like, sleep is fine. And they interpret that as a lack of interest, which it may not be, it's just a timing issue. On another couple of lectures here, we talked about depression. When you're depressed, the way I tell people is when you're depressed, it's kind of like the Maslow triangle, right? You've heard of the psychology thing. Basically, you're just keeping your head above water. Sex is like unimportant. You're just trying to survive. Sex is one of those things that maybe later when you're doing well. So depression is really common. Often people will come in, they don't say, you know, doctor, I'm depressed. They'll say, oh, my husband says I'm not interested in him anymore. Well, we start talking, and this lady's not interested in sex, or going out to eat, or videos, or taking care of the kids, or anything. And so then you start going down those depression questions. So that's also really common. So fatigue, depression's common. Another one is the partner could be a jerk. I know you don't believe this, but... So let's pick on the guys a little bit longer. The guys are jerks, and then the only time they're nice guys is because they want sex. So women are fairly bright. They go, okay, you're always a jerk. Now you're trying to be nice guy. Thanks for the kiss. And so it's kind of like women could see right through that, and that could also decrease the interest in sexual activity. So that's also really common. There's sexual pain disorders. Why have sex if it hurts? Why? And by the way, sex can hurt in males and females, and we'll talk about that, and if anybody has questions about that. So those are about 4. There's a couple of other possibilities. You know, the fatigue is important, but it's kind of an excuse because people can have sex Saturday at 2 p.m. if it was just fatigue. So there's usually other issues, the interaction issues. So any questions on when sex doesn't work? Anger, I think you can lump it good with interaction issues. They did an interesting study. They asked people, why do you have sex? And they came up with a list of about 160-something different reasons. And some of them are to keep a mate. Some of them are just want to have sex. Some of them is anti-pain. Some people it's to sleep. I mean, I made a joke the last lecture, but it's true. I mean, everybody knows the guys roll over and fall asleep. Well, it just doesn't happen to guys. We hear it all the time with the women. So there's a lot of reasons. And anger, a lot of women will withhold sex. Why, why would you, I mean, it's basically as a punishment reward. Why would you have sex with somebody who you're angry with? So there's definitely a lot of reasons for having sex. Oh, and let's even back up even further. When I say the word sex, my definition, and in the book, is any stimulation of the genital parts for pleasure. Okay, that's important because I'm a physician. When I talk to my teenagers about sex, they go, oh, I've never had sex. Well, I had oral sex, I had anal sex, but I've never had sex. Okay, and that reminds us of presidential issues, right? So definitions are really important. I've got lesbian patients, a lot of them. So when we say sex, it's not intercourse. Potentially, it could be all sorts of things that I have to be very clear about. So when I say sex, I mean any kind of stimulation of the genital organs for the purpose of pleasure. Okay, so that's important because, again, semantics, as a doctor, I have to be very, very clear. Okay, what's the next title? This is a porcupine. This is me walking on coals. And so, sexual pain disorders. I always wonder how that works. How do porcupines reproduce?
Carefully.
Apparently. So this guy, it was a young man, it's about 4 years old. Lisa called me emergently, paged me. Oh, got an emergency, it's a porcupine running around the road. So I had to go help him off the road. But he's in a little box there, and I put a big leather glove, and he's eaten 2 trees since then, by the way. They absolutely strip trees down. They're not that good for the trees, but he's doing well. I know that because he keeps on eating my trees. So, sexual pain disorders. I told you that we're going to have male sexual pain and female sexual pain disorders. I'm talking about physical pain, not emotional pain. In males, there are a bunch of anatomical issues that can cause pain. Guys can have pain with erection, they can have pain with ejaculation, they can have pain in general. It's actually, intercourse takes about 200 calories. They've done the studies. Okay? So, this is important. I know it sounds funny, but what's real interesting is we have a lot of cardiac patients that are worried about dropping dead during sex. And so, what we know now, on average, it's about 200 calories, which is the equivalent of walking up 3 flights of stairs. They've done these studies. And so, I'll tell the couple, I go, look, can you walk up 3 flights of stairs? Oh, yeah. Then you're not likely to drop during intercourse. And that helps. And then, what's really interesting, it's usually the woman who gets more concerned. Oh, he's going to die on top of me, that kind of thing. I go, okay, hold on. Shh. Let's talk to him. And there's almost no guys that said, yeah, that'd be terrible. Right? So that helps her feel better about the whole situation. So that's really rare that this occurs. Okay. All right, so sexual pain disorders, guys have all sorts of interesting things. The penis actually has got 2 tubular structures that fill up with blood that cause an erection, and one can get damaged, so there's something called core D. Things get a little bit sideways, or downward, or upward, and all sorts of things. So there's some distortions. There's all sorts of ejaculatory pains. There's something called retrograde ejaculation, which is common now. And basically, instead of semen going out that way, it goes into the bladder. And then everything's kind of go backwards. It doesn't cause pain, it just surprises people. It's like, oh, there was a movie, what was it? What About Somebody, right?
Yeah.
And it was in the hair.
Yeah,
remember that? I forget the name
Something
of it.
about Mary. Something about Mary.
I was surprised when I saw that, but it's kind of funny like that. It's like, okay. But it's the same thing, and it's not dangerous or anything. In fact, from fertility perspective, since I do a lot of infertility, sometimes we'll wash the urine and get sperm to inseminate a wife. So there's some tricks that we know about. So guys can have pain, women can have a lot different kind of pain. Technically, we call that dyspareunia, or painful intercourse. I hear this all the time. This is really common. And there's stretching issues, there's vaginitis, infection, scarring, there's a uterus that gets bumped, there's endometriosis, there's a ton of things that can cause pain. When I talk about sexual pain disorders in women, I need to, if it's just getting in, there's some muscle spasm, that's called that, know where it is. Something up there getting bumped, and women will typically say, oh yeah, it's going fine, it hit something, vaginismus. If there's, we'll have to stop, that's deep dyspareunia. Then we look at uterus and scarring and endometriosis. Sometimes they'll say, well, it hurts afterwards. So that may be a vaginitis, a tearing, a uterine pain. There's some orgasmic pain issues. There's even a rare thing called a orgasmic migraine. And I'm hearing that more and more because I'm actually asking my patients. So sex is great, orgasm's great, and then they have a migraine for 3 days. So that happens.